Welcome to Inside Drug Discovery. This video gives a brief description of a drug, CRENESSITY, which was recently approved by the U.S. Food and Drug Administration. I will mostly focus on the medicinal chemistry properties of the drug rather than its therapeutic benefit.
CRENESSITY was approved on December 13, 2024. CRENESSITY is approved as an adjunctive treatment to glucocorticoid replacement to manage androgens in patients with classic congenital adrenal hyperplasia. The active compound is crinecerfont. The drug is administered either as an oral capsule or oral solution. The dose in adults is 100 milligrams twice per day. As we shall see, CRENESSITY is approved for use in patients as young as 4 years old, and pediatric patients require an adjusted dose. The NDA applicant is Neurocrine Biosciences in San Diego, California. The prescribing information insert of CRENESSITY is cited at the bottom of the slide, and this reference was the primary source for this video. Classic congenital adrenal hyperplasia, CAH, is a genetic disorder that is diagnosed during infancy, sometimes even before birth. In classic CAH, a patient has a defect in an enzyme, either 21-hydroxylase or 11-beta hydroxylase. The result is impaired cortisol production. Aldosterone can be affected as well. As many steroids are produced from common precursors, reduced cortisol and aldosterone production leaves excessive quantities of precursors to produce elevated amounts of androgens. CAH treatment involves the administration of high doses of glucocorticoids that are downstream of the reaction catalyzed by the defective enzyme. High doses of glucocorticoids also reduce the overproduction of androgens. Excessive glucocorticoids, however, can lead to undesired adverse effects. Here is where CRENESSITY comes into the picture. CRENESSITY antagonizes the corticotropin-releasing factor type 1, CRF1 receptor. Blocking the CRF1 receptor reduces secretion of pituitary hormones that lead to the production of androgens. CRENESSITY therefore suppresses androgen production. Even with CRENESSITY, classic CAH patients still need steroid treatment. The glucocorticoid doses, however, can be reduced because they are less critical for suppressing androgen production. CRENESSITY supplements the traditional steroid treatment to improve patient outcomes and therefore is considered an adjunctive therapy. On this slide are some of the physicochemical properties of crinecerfont. Most of these values are from DrugBank, an excellent online database. The one number that stands out to me is the log p-value, a calculated log p-value at 8.88. Crinecerfont is an extremely lipophilic compound for a drug. In fact, I can't recall a drug with a log p-value this high. I'm surprised it has adequate solubility for oral absorption. The last line is crinecerfont's binding constant for the corticotropin-releasing factor type 1 receptor from the Guide to Pharmacology. Crinecerfont is quite a potent compound. The pharmacokinetic properties are on this slide. The volume of distribution is over 850 liters, which is quite high. Highly lipophilic compounds like crinecerfont often show more extensive distribution, as the compound might have a higher affinity for membranes, adipose tissue, and even the skin. The oral bioavailability is not reported, but the prescribing information does provide some clues. Here is a paraphrase. Area under the curve increased 3.3-fold with a high-fat meal compared to fasted conditions. If AUC can increase over 3-fold with food, then the fasted oral bioavailability cannot be any higher than 20 to 25%. Other language in the prescribing information implies the bioavailability could be even 10% in fasted patients. Crinecerfont undergoes hepatic metabolism, mostly via cytochrome 3A4. No metabolite structures are provided. I would guess that metabolism occurs at the carbons next to the nitrogen, or perhaps OD methylation, but those are just guesses. Excretion is mostly in the feces rather than the urine. In both cases, the amount of excreted unchanged drug is very small. Crinecerfont is excreted in a metabolized form. CRENESSITY does carry some warnings and adverse reactions. 2 warnings are listed. First, hypersensitivity is possible, with symptoms being typical for an allergic reaction. Second, adrenal issues are possible. For this reason, patients are advised to continue taking appropriate doses of steroid hormones in addition to CRENESSITY. Adverse reactions observed in at least 4% of adult and pediatric patients include headache, fatigue, and certain types of pain. That concludes this summary of the approval of the new drug application of CRENESSITY, which was granted by the US FDA on December 13th of 2024. CRENESSITY is an antagonist of the corticotropin-releasing factor type 1 receptor for adjunctive treatment of classic congenital adrenal hyperplasia. Thank you for watching this video. Please consider liking the video, subscribing to the channel, making a comment, or leaving a question. Take care.